Fantastic. So welcome to this webinar. This feels a really momentous webinar. I think in Christian's words, this is our last response type webinar, and we will then start to hit recovery mode, where we'll really start focusing on exploring how we can work together across the whole system to support our children and young people via the school system. But we're going to wrap up everything with this sort of a webinar and just sort of hearing from our public health experts, pediatric sort of experts on this last sort of stage as we look forward to the joy of recovery. I've got three things that I want to sort of flag up just before we start proceedings. So the first thing I just wanted to say was what a great day I had yesterday, because I actually managed to step foot inside a school. I'm aware for a lot of sort of people that's a pretty sort of a standard sort of a thing, but for a number of us, you know, those sort of gates have been down. But I had a really fantastic day yesterday visiting Lilycroft, where working with sort of Nicola and some of the Ed Science sort of our team, because Look North were just featuring some of the work that we're doing around autism. And Christian kindly shared a link with Schools Weekly, which I've got to confess I don't normally read, that was just highlighting some of the work across sort of Bradford. And I just want to say thank you to everybody on this call, because none of this work is possible without us all working together to try and explore creative and innovative approaches to supporting the needs of our children and young people. I just think it's a fantastic testament to what's happening across our whole district, that this work is starting to really land. And that brings me on to the second thing that I wanted to flag, and that's what a brilliant morning I had this morning as I participated in the summit that was organised by some of our multiple academy trusts and sort of our schools, where we heard from the children and young people about their concerns and their needs, and it was just brilliant to hear the passion of those children and young sort of people and their insights. And I really think that they have given us a great sort of challenge back to all of us in all the different parts of our system to work together again to sort of see how we can accelerate that recovery sort of a process. But just a phenomenal session and just a reminder of what sort of talent we have throughout the sort of district, not just in terms of sort of our senior leaders or practitioners within the sort of a system, but actually the children and young people themselves. And that actually then takes me on to the third thing that I wanted to flag up, which is that we've been asked by a number of different routes to start helping produce a plan that can help feed into some of the policy decisions that are being made around education. And I've got to sort of say that my sort of first response to these sort of requests is that we had very little sort of contribute. But I was happy to say, I know, though, individuals who are experts who should definitely be contributing into conversations about policy changes around education. And so this is just an advert to say that we will be asking everybody on this sort of call, everybody as part of the sort of community, to contribute towards our first efforts to draw up some potential sort of suggestions around what we can do to change certain sort of policies in order to improve the way the system sort of currently sort of works. And I think there's a window of opportunity for us to work together to really make some good sort of recommendations. And I think we can get a lot of weight behind it so that hopefully it might actually cause some really meaningful sort of a change. So we will be writing to you about that. We will really request all and any sort of help to pull together that high level sort of a plan that will then get in front of the right sort of people and hopefully make some really meaningful sort of policy changes. And related back to my second sort of point, it'll be great to get the voices of the children and young people in that as well. So there were the three things that I wanted to flag up, really optimistic things, I think, that actually, were for me the real sort of signal that this is the end of COVID response, and it is now the point at which we start to really look forward and say, how can we settle in for the long term to tackle the inequalities, to tackle all the issues within the sort of system, and really take the opportunity perhaps to challenge the way that things have been done and suggest ways that we can do things better. And that's my quick sort of a roundup of things at my end. So what I'm now going to do is hand over to Helen and get her insights from the ward. and what's currently occupying the thoughts of paediatricians. And I think hopefully also that's going to be a little bit about hitting that recovery in the longer term health of our children and young people. So Helen, can I hand over to you now, please?
Yes, thank you, Mark. And it's always reassuring to me when I don't have masses of new things to say to you, but actually what we're doing is mirroring what you're doing. So that feels good that we're working together in some way. There are no massive changes since I spoke to you. As we sort of predicted, as the children went back to school, our activity increased on the ward. And just to be clear, that isn't with an increase in numbers of children with COVID-type symptoms. It's just an increase of activity overall. Massive increase in minor injuries to A&E. So our A&E figures are back up to their normal levels, and just a mixture of things coming to the ward. So we're back to probably being more busy than we normally are at this time of year. A really big thank you. I think the children went back into school at the beginning of that week, and we had some phenomenal referrals where parents came to the ward saying that the child had gone into school and teachers or head teachers had noticed a change in them. And there's been some really quite significant conditions picked up really by yourselves, seeing a change in the child over time. So I just wanted to feed that back and say that's been really useful to us, and really just giving encouragement to families to continue seeking medical help where there's concern. We are here and we're working as normal. So we're business as normal. We're plodding on and working our way through on the acute wards. And really all of the rest of our effort is mirroring what Mark is doing. We are trying to catch up in outpatients where we have not been seeing children face to face. There are some families that we think we will continue doing phone consults to try and minimise the amount of time children are coming out of school. There are some children that we will need to bring in face to face, and we're trying to catch up over the next few months. In general, anyone that we've been worried about, we have kept up with through the last year, so that you shouldn't see a big change. And then a lot of planning. So a lot of working closely with our partners in CAMS to try and get our pathways as optimised as we can. And that's both within Bradford and the Act as One system, but also across the ICS and working with our partners at the other acute trusts in Yorkshire. And I've noticed a question about obesity, fitness and mental health. And I think they are really, really key areas. Being honest, we don't see as much on the ward. I think I spoke last time about outpatients, and we saw some quite significant increases in obesity. I'm really pleased to say today I've seen some families that made really good inroads into that, and I can see that children are already getting more active as they come back to you. But there is no doubt that this has impacted on obesity for our children. And there are some projects that we're working on to try and I know you've been doing a lot with school, Mark, or Duncan may speak about that, but I think coming back to school is going to be key for that. Fitness as well, I think you're going to be key, and mental health, just lots of joint work that's going to need to be happening. And I think some things we'll be bringing back to you over the next few months, asking for your help. Now I'm trying to keep up. Is there anything else for myself in the chat?
So there's a question from Helen Williams, which is saying, what do schools do when a child is sent home with a headache, stomach ache, slight temperature, and parents state the child is fine to return within 10 days, symptoms has lapsed, yet no PCR test has been undertaken due to worry that swabbing would encourage cancer, or they took an Lnfd home test and that was negative?
So Duncan, do you want that, or shall I? Because I think if you've been self-isolating for the 10 days, then actually you've already done what you would have done if the test was positive. So I would say that was if they've, no, within 10 days. I'm reading.
Yeah, I think the question is, what happens if the parent goes, oh no, they're fine now to come back, and you don't have any positive evidence that sort of suggests that they are fine to come back?
Duncan, I'd be grateful for your thoughts on that, but I think if you've had a pyrexia and you don't know, then you should be presuming. But what would you say?
I think if you've got COVID symptoms and you're within that 10 days, you should be at home, and there's really clear guidance that you need to have a test. If you've had an Lnfd test and it's taken at home, you need a confirmatory PCR anyway. So once you've had a confirmatory PCR and that's ruled out COVID, that child can attend school. But it sounds like from that description they're in school with infectious disease symptoms anyway, because it's stomachache as well. So I know it's difficult, but I think you sort of need to send them home again and just be really clear that this is the guidance.
Thanks, Duncan. So, Helen, there's a couple of questions from Christian. I think you've addressed the first one, which is the impact of the pandemic on obesity, fitness, and mental health. But the follow-up question is specifically with regard to the children who've got significant additional learning and/or health needs.
So I guess these are children that we're really concerned about. It's actually something I've spent a lot of time speaking to my colleagues in the Child Development Centre, and I think we're seeing two impacts. There's the impact on the children themselves, and that's been not quite as evident. The massive impact for us has been evident from the parents, and they're seeking help. And what's been, I think, really stark is that their normal support structures have not been there, and these parents have been really, really struggling. And then we've seen that impact as well on the children. I think it is mainly the parents that we've been more concerned about. A lot of phone calls asking for support about things that would normally be taken in their stride, things like behavioural issues at home, things like sleeping issues. So things that would normally be supported from the community are all coming into ourselves. So yeah, that's I think that has been the main impact.
Yeah, and I guess what we're seeing in a lot of the sort of data, Helen, is just that COVID has magnified all inequalities. And that's just at multiple sort of a level. So the hardest hit communities are definitely the more sort of deprived sort of communities. The more additional vulnerabilities individuals have, the greater the sort of toll that COVID seems to be sort of playing. So, Helen, there's another question here from Christian, which is about any further information about COVID and pregnant women and new mums.
Christian, you're asking me lots of difficult questions. I'm going to. So there are ongoing concerns about pregnant women in the last trimester. And I think it'd be fair to say that that's still probably very much the situation, that as soon as you get to 28 weeks, we're recommending no face-to-face contact and to try and be really cautious. The numbers are small, but and there are a few cases that have come through with, there was a case very recently about querying whether a pregnant woman had managed to pass to a neonate a similar sort of inflammatory condition, but the N numbers were really small. So I think people are monitoring, the BPSU is collecting data monthly, but at present time, it's just for people to be careful in the third trimester.
Brilliant. Christian apologises for his hard questions.
Yeah, I'll make sure I'm prepared next time.
Okay. And then there was a question from Richard here. I'll read it out, Helen, but Richard himself says that it might be for Duncan. So anecdotally, Richard has heard of a school planning ahead with the thought that there's going to be another wave and therefore lockdown in summer too. Are there any indications that this is a likely scenario?
So there has been some modelling by Imperial College and other areas about what happens as we move through the roadmap towards June the 21st. And that does predict a rise in infections again nationally, just because there's still about 50% of the population have had the first dose of the vaccine, but there's still a big unvaccinated group and a big group that have only had one dose. So that is the prediction, that there'll be a rise in infections again. How much that will rise, nobody really knows, but that will lead to a slight rise in hospital admissions. So the sort of the shape of the graphs, and certainly the reports that I've seen, is that it's going to be nothing like we've seen over winter and what we saw back in March and April. But unfortunately, that there is. But whether that will lead to another lockdown, that's anybody's guess, I'm afraid. We can't say that or not. I mean, if you look at the government's forecasts about coming out of lockdown, they talk about pressure on the NHS, and certainly the pressure on the NHS does seem to be going. I know Bradford Royal Infirmary have closed one of their admission wards for COVID, and there's under 40 people in hospital now in the whole of Bradford district COVID. So the pressure on the NHS isn't huge. And the number of deaths has really come down as well. So we're under 10 a week in Bradford, and we're monitoring the new variants that are coming into the country. So those conditions have been met, even if there's a slight rise. So I'd be surprised if there was another complete lockdown over summer, really surprised. But as we've all learnt with COVID, you can't give 100% predictions, I'm afraid.
Great, thanks, Duncan. And I guess you'd probably also say that the modelling depends on whether everybody goes on some holidays abroad or not. So I think if there's one thing that we can do to try and improve the situation, it's encourage everybody not to go to Spain for their summer holidays, even if they're allowed. Helen, thank you so much for that. That's been absolutely brilliant. I think that's all the sort of questions now. Can't thank you enough, as always, for coming along and sharing your insights. So Duncan, I think it's back to you and George now for our key public health messages.
Okay, thanks. Mark, just so I know, how long have we got on the agenda for this? Is it 20 minutes? 20
minutes.
Yeah. Okay. So myself and George are going to do a double act because George has very much become the expert on this. It's no way it's me anymore. And George is going to take you through some of the key questions and answers that are coming through to us in public health. And then there's been some work that George has been doing around a flow chart to answer these LFT questions that come through. So we've got one pager for you as well that George is going to talk about. And just before we start as well, just to clarify that I work for public health in the council, not Public Health England, because a few people on the last one thought I was in Public Health England, and I've nothing against Public Health England, but sometimes the council gets a bit of a bashing. So I just want to say we are doing this from the council. Okay, anyway, that was just a point of clarity. So there's a few things that I just want to update you with. The first one is that there's going to be some guidance on the extracurricular activities as well, and some aid memoirs for that in terms of working with providers of those sorts of events that go on in your school. And George has produced that. I'm sure he'll mention that as well. So that's just to help you with all the Easter and summer activities that might go on in working safely within your schools. The other thing is that you might have heard about the £500 self-isolation support payment for families has been extended. So it's not just people with COVID that have been contacted by NHS Test and Trace now. So families are going to be eligible for that if another member of their family or a child is COVID positive and they're having to stay at home to look after them. So that's changed, and we're just working up some really straightforward messages for parents for that, so we can pass those on to you, and that'll be going live after Easter, I think in the 7th of April. So hopefully that'll give you something a bit more to be able to support parents that feel that they're going to be financially out of pocket. The other thing, just to pick up on obesity, because there's a question for Helen, and I know that a lot of from these conferences and other conversations I've had with heads that you're really concerned about physical activity levels after a year of disrupted education. So the National Child Measurement Programme that measures reception in Year 6 children has been sort of more or less on hold for a year. Public Health England have told us that they really want that going ahead again. So we're going to be working with the School Nurse Service, and they'll be contacting you, and you'll have already had some a bit of information from Mariam Hack about that. So we really want primary schools to get involved in that, because as part of the response to potentially rising rates of obesity in young children, we really need to get this measurement data. So all the cooperation from primary schools that we can in that programme would be really much appreciated. Because we know from the Born in Bradford surveys that children are getting less physical activity, and they've got more anxieties about a wider range of issues. We haven't got any actual measurement data yet, so we can't say whether obesity has gone up. So this programme is really, really important for that. So it's just to say cooperation would be really appreciated. Okay, so just to bring you up to date really quickly on what the data is telling us at the moment. So in Bradford, 43% of the population have now had a first dose, and the second doses are going ahead really quickly through the 80 plus in the care homes. But what you will see now is the vaccination programme will slow down a bit for the rest of the population, because all the second doses have got to be managed as well, that started in December. So that will mean there'll be less vaccine available for the first doses. And then you've also started to see the sort of vaccine wars started in the papers, and there'll be a lot of national and international negotiation around that. I know that the UK government's ordered over 200 million doses of vaccine, so we have got enough for the country, but it's just how quickly that comes through that will be an issue. But in terms of the other factors, I've already mentioned them really briefly, but in terms of the harm of COVID in Bradford, in Airedale and Bradford Royal Infirmary hospitals, it's really shooting down. We've got only 30 people in hospital now, which is good news, and the numbers of deaths on a weekly basis of COVID has gone below 10. So that was 9 deaths in mid-March in a whole week. So that's the first time we've had that for months, actually. So the lockdown and the vaccination programme really have had a big impact there. In terms of the infection rates, and I've already mentioned that, this is the thing that worries me, it's plateaued in Bradford. We're at about 140 per 100,000. So we're in the top 10 local authorities in the country again, unfortunately, in terms of rates. So that 140 compares to 60 across the whole of England. And at the moment, in terms of where infection levels seem to be highest, there's been a bit of a shift towards Keighley in the last couple of weeks. So the 3 wards in Keighley appeared in the top 10 areas in Bradford for the first time. So it's just something to be aware of if you're working in those areas. It's not hugely spiked, but it has definitely gone up in Keighley in the last week. So what I've been trying to do is make sure that all the council hub volunteers and the door-to-door testing and all the messaging and so on is going to be concentrating in Keighley in the next couple of weeks. But in terms of what's happening to infection rates within children, so the 0 to 3 and the 4 to 7-year-olds, that's fairly level. We're at about 70 per 100,000, so that's below the overall level for Bradford. But in terms of the 11 to 18-year-olds, the secondary school age, we have seen a definite increase in that in the last couple of weeks. That's gone up to 176 per 100,000, so that's above the overall Bradford rate, this is a worry for me, and I think we're just going to have to try and manage this. We'll see what happens. We're coming out of a lockdown, but the overall harm from COVID in terms of deaths and hospitalisations is really going down. But if infection rates start to go up in children, that's going to be a really complicated narrative for us to manage about harm within schools. So you just sort of need to leave that with us, and we'll see how we manage that, because we're so committed to this recovery period now and trying to make sure that kids get their education and social development. So we're going to monitor that really, really carefully, and all the support that you get through public health and education teams will still be there next term when you come back. But we've seen the numbers of schools with clusters climb. So we're at 66 schools have had 2 or more cases in the last couple of weeks, and that's gone up quite rapidly in the last few weeks. Fortunately, there doesn't seem to be much in-school transmission, and all the work that George and Femi and Martin do around trying to stop that transmission within schools seems to be paying dividends, because there's only 5 or 6 of those schools where we really think there's outbreaks within schools. The vast majority is it's still coming in from the community. So that's that. And then the last thing is about the lateral flow testing. So thanks for all your efforts in secondary schools and getting those centres going. I know that was a huge bit of work just to do 3 tests in schools. What we're finding now is that the lateral flow tests are picking up probably about 20% of infections in that area, in that age group. So it is having some impact, but it's quite low positivity rate. So 1 out of every 1,500 tests in secondary school age group is testing positive. So not a very good return rate, I'm afraid. And I know it's been a huge amount of work. We just have to think about it in terms of every intervention adds a little bit to our fight against COVID. So I think it has been worth it. And we're getting about 7,000 children a day that are testing now in Bradford and taking those tests at home. So that was just to give you a little bit of feedback on that one. The other thing, just to let you know as well, I just want to reiterate what Mark was saying, is that we're increasingly want to start supporting schools now around this recovery period about the mental well-being, physical health, the lifestyle and so on. So you will hopefully start to see more of an emphasis move towards that from all of us next term, and supporting well-being within children long term. We will of course be there to support you around COVID and making sure schools are as safe as possible, but we really wanting to be thinking about those long-term benefits for children about being in school. So I'll and the only other thing that I'll feedback on, and because I think it would be worth it, is I was at the schools conference this morning as well, and it was, as ever, like really awe-inspiring, just hearing like secondary school kids and sixth formers talking about these issues so eloquently. And I was asked a question by Hassan at Dixon's Academy. When we come out of the roadmap, will this be the end of the pandemic, and what will happen next? And I thought, thanks very much, Hassan. That's a really easy question to answer. But I gave it my best, and I have been forewarned. And I just thought it might be something useful just to feed back to you what I think the changes are going to be, because you might want to talk about this to some of your kids as well. And I think the overall answer that I gave is that we will hopefully start to see things getting easier, children getting their freedoms back again, being able to mix and so on. But there will be some things about COVID that will be a hangover, and they might be around for a couple of years. And the main things that I fed back to that conference were, first of all, there's going to be the vaccination program that will become like the flu vaccination program. There'll be annual boosters, there'll be new variants of COVID that will all go into vaccines. And it's really important that we keep the population and communities really on message around that vaccination. So that's the first thing. Second thing I said was around outbreaks, that even if things come out in terms of you don't have to wear masks anymore, and we get rid of social distancing, COVID's not going to go away. We're not going to eradicate it. So there will be isolated outbreaks, and there might be short periods in schools where you have to put those measures in again. But we very hope and expect that isn't going to be anything like lockdown. So I suppose my message was there will still be a little bit of disruption, so we still need to keep our eye on the ball. The other thing that I said was that there will be some, even though we're not walking around with masks, and even though we get rid of social distancing, hopefully, there may still be some environments where we have to do that. So health services, areas where we're going into environments where there's clinically unwell or vulnerable people, there will have to still be some sort of COVID measures, I think, for quite a while. And that's something that everybody's just going to have to be respectful. And in terms of the way that you teach your kids about their role in the community, I think that respect for COVID as we move forward is really important as well. The fourth thing was around use of video and link up and digital working. I said that I think there'll be some changes that have come in, and the way that we talk to each other, the way that we receive support and so on, that will be via video or via face-to-face. But one of the things that we were all really adamant on the conference was that there's nothing like a human being, and there's nothing like human contact. And where kids need that human contact, they needed that trusted individual and adult, we really need to make sure that that's there for them. So there'll be a difference between digital link up and face-to-face and person-to-person contact. And then the last thing was around international travel. I think Mark's already mentioned this. I'm probably the same as you. I am absolutely sick of COVID. And if I think that there's been some relaxation so people can go on holiday and start bringing new cases and variants back, I'm going to be personally marched down to Whitehall myself. So I think we've just got to get used to this country. It's a beautiful country. We've got to go on holiday in this country. We've got to get used to traveling around this country for a bit. Forget about international travel. We've got a really good surveillance system for new variants coming in, but we really need to minimise that. So that was, I mean, a lot of the kids that were online were not going to be in a position to get international travel. But I just said that's one of the things that will be disrupted for a couple of years, I think. So just start enjoying your own environment and your own country. So those were the things that I fed back that I just thought would be useful. And I'll pass on to George now, who's going to do the technical bit around lateral flow tests.
Okay, good to see everybody. I have some slides because most of the information I have is very direct and graphic. I think it's going to be easier for you. I'll talk about this guidance that Duncan mentioned for out-of-school activities over the holiday, but it's something that will probably update as the roadmap evolves, and will serve as a source of reference for out-of-school sports, leisure, and other activities that happen on the school grounds or out of the school grounds. And I'll talk a little bit as well as about common questions that from these first 2 weeks after school return, about LFTs, PCRs, and all that is related to that. And I'll try to finish with kind of an ultimate flow chart that I really hope that is the last one that will be I will need to produce for you. So I'll share my screen with you just for us to go through this. Just a moment. I'm not being allowed to share files. I think
Screen
it's some
sharing
kind
is
of,
screen
is it some kind of
sharing is
permission?
allowed, Josh.
Mm-hmm. Yeah, just a minute. I'll go around this. Just a minute.
So George, just while you're doing that, I don't know, Duncan, there were a couple of questions for you that maybe you could take just while George is getting sort of set up. So one more question was, what are the rates for the 7 to 11-year-olds?
7 to 11-year-olds were, right, so I haven't got the 7 to 11-year-olds. The 4 to 10-year-olds are 70 per 100,000. And the 11 to 18-year-olds are 176. So if I was going to guess, it'd be somewhere between that, I'm afraid, but I haven't got an exact one for 7 to 11s. It tends to go up as you go up the age groups.
That's great. Thanks, Duncan. George, are you ready to share your screen yet?
I think so.
Brilliant.
Let's see if it happened. Did it work? Can you see my?
Yeah, that's perfect. Thank you.
Okay, let me just make it bigger. Okay, so this is basically what is in the roadmap of new activities allowed as part of the step 1 of the roadmap. So from 29th of March, we'll be allowed more outdoor activities. So indoor activities will still be restricted to vulnerable children and children of parents that are seeking work or doing education for career purposes, but we will be allowed to return. The rule of 6 will be kind of more flexible, so we will be able to meet another household without limit of people. So 2 households together outdoors, including private gardens, without limit for people, provided that social distance between the 2 households are maintained. And care bubbles and child care bubbles still count as 1 household. Outdoor sport facilities will be reopened. That means basketball courts, swimming pools, and organized sports will be allowed without limit of people, so without specific limits. So we don't need to be more 5-a-side matches. We can have, for example, a full game going on if it's organized by a sports body or in a club. There will also be some changes for outdoor parents and child groups. So things like outdoor play groups, for example, will be allowed up to 15 adults with unlimited number of under 5 children. So this means a good flexibilization of things to do over the holiday. So we produced the guidance that you will all receive. So Loudon and Martin should probably send it to you between today and tomorrow, and I can upload at the end of the seminar as well. And this is what I cover in the guidance for out-of-school activities. So there is a summary of the spring roadmap that I've just showed you, with some notes about aerosol transmission in indoor spaces, ventilation. There is a guidance. This is a guidance for the providers of outdoor activities. So just a note on the purpose of this. This was a request of you, of the heads of the school leaders, and is intended to for you to use when you need to talk to a club leader or a sports club leader that wants to do an activity in the school grounds, but it's also something that can be shared and distributed across the community for other providers and organizers of out-of-school activities. So because of that, there is a section on risk assessment in which I outline the system of COVID control that you are well aware of, but for example, our sport club leader will not be. There is a session on how out-of-school providers will be responding to COVID cases. So how about self-isolation, everything that you know about test and trace, who do you need to call during the holidays? The calls will be made not to the school, so we are not charging you on that. If someone happens, even if it's on the school grounds, if a COVID case or 2 or more cases arise, we are signposting them for Public Health England, and if needed, if it's another workplace, like for example, a private setting, to the local authority contact center. Then there is some advice on group size and setup, because government is not absolutely clear on how many people can join, for example, an outdoor activity that is not a sports and not a parent group. So I would go for the rule of 15 that is valid for the parent group, that is 15 adults and carers of vulnerable children do not count. So you can have up to 2 carers of a child that is has clinical vulnerabilities over these 15 counts. The leader of the group does not count. So there is some flexibility of the size of the group, but there are some tips on how to control that in a safe way. So for example, if it's an activity that demands a lot of touch-to-touch and face-to-face contact and proximity, the size of the group needs to be reduced. If ventilation of the space is not so good, and so on. There are specific guidance for sports activities with links for the specific sports guidance that was provided by national bodies. And here, for example, there are tips about not shouting, not sharing helmets, putting the balls into a sack instead of passing them to the trainer, and some things like this. There are guidance about music, dance, and drum activities. So, for example, use of microphone to allow raising the voices, how to share the microphones and equipment in a safe way, and some tips for parent and child groups. So I think basically about play groups or groups that are organized by charities, but that are basically parent and child groups. They can work with 15 adults. And there are some tips for you, school leaders, and the providers to communicate with parents about those things. So what are the really important things that matter about safety, what you cannot do not bring your child if it has COVID symptoms, etc., and some links to the national guidance. So you will receive this a detailed link, and there are 2 companion documents that are very short. One that can be handed over to the provider of the activity that's about how to manage COVID cases, and another one that is a summary of the system of controls that you use, for example, as a basis for your risk assessment in the schools. So this is the guidance for school activities. Second topic. The second topic is about the common queries that we've received over the last 2 weeks about LFT tests. So these are the big 5 questions that we repeatedly needed to answer and discuss within the Council and with Public Health England. First is when to do an LFT and when to do a PCR. So for example, you cannot do an LFT when you were returning from travel or to release you from self-isolation. The other one is when does self-isolation begin after a positive LFT, if you need to wait for the confirmatory PCR or not. The other one is if you can leave self-isolation using a negative LFD as a basis for that. The fourth question is about extending self-isolation with new cases in the same bubble come up in the school. That is a tricky one that we needed to answer with a case-by-case discussion a few times last week. And the last one is about what happens if someone just left self-isolation for other reason, for example, because the parent was sick and then tests positive with an LFD at school. So when to do an LFD and when to do a PCR. So the lateral flow tests are for detecting asymptomatic cases. So they are used in other settings with other purposes, but in the school program, they are using absolutely only for that. So they do not rule out or confirm infection in a suspect case. The PCR, on the other hand, is a confirmatory case for suspect cases. And the suspect case can be either someone with symptoms or someone who tested positive with a home lateral flow test. So when to do a PCR, PCR or not to PCR? If the lateral flow test was made in school, if it was collected at school or another assisted center, that means in a community testing center or in a research center for other purposes, you do not need a confirmatory PCR. So this lateral flow test, not self-administered, but collected in an assisted setting, is considered as equivalent to a PCR. It's confirmatory of COVID or excludes COVID. Non-assisted lateral flow tests, that are those that we are all doing at home now, including the parents of the children, they need to be confirmed by a PCR if positive. If negative, you just follow on with the regular testing or whatever you are engaged with. But if the lateral flow test is positive at home, it needs to be confirmed by a PCR. However, self-isolation should start immediately after the lateral flow test. And if necessary, if the PCR is negative, we can call back the contacts that were advised to self-isolate. So after a positive home lateral flow test, you should trace contacts in school. The household should self-isolate. All the school contacts must start self-isolation. And in the event of the PCR coming up negative, all the case and the case, if it's feeling well enough, and the contacts can all leave self-isolation. What that means is that a negative PCR does overrule a positive home lateral flow test? That was a common question that we received this week as well. And just a reminder that if someone who is already self-isolation, develops symptoms, they should not take a lateral flow test. They should book a PCR test. If they take a lateral flow test, regardless of the result, it has absolutely no value. What leads us to the third question, that is, can I leave self-isolation earlier if I test negative with a lateral flow test result? And there is a simple answer that is no. If you are a COVID contact, if you were identified as someone who needs 10 days of self-isolation as a contact, there is not such a thing as a test to release scheme. There is a test to release scheme for travelers that come from selected countries, but it's a paid scheme that needs to be booked by the government side, and it is not of much value because you need to do the test in the 6th or 7th day, and then in the 9th day, maybe you will have a result and you will be released 1 day before the 10 days. So a negative lateral flow test taken during a self-isolation period means nothing and does not release you from self-isolation. And then you can ask me, but what if this child has this test in an assisted center that is equivalent to a PCR? It's the same. If they had a PCR during a self-isolation period, they would need to complete the 10 days anyway, because you can still develop infection in the following day, in the other day, or at any point of the 10 days of self-isolation. Then we have two tricky questions. One of them is if you need to extend self-isolation once new cases come up in the same bubble in which a case was already identified. So there is not a simple answer to this one, but I'm trying to do my best. That is the following. In most cases, if the bubble is already self-isolating because of the first case, the self-isolation of the contact will not need to be extended. So for example, if you send everybody home on a Tuesday, and on the Friday, you know that someone who was in school on Tuesday tested positive as well, a second child on that bubble, you don't need to extend and restart the self-isolation period of that bubble, reset it for Friday. Just because we are following more or less the same guidance that applies to households. And I will show a picture that is quite useful for understanding that. So if the new case arises when the children were already self-isolation, do not extend the self-isolation period. However, if the new case was in school and developed symptoms while in school, while you were, for example, awaiting for a child that was sent home and you did not isolate the rest of the bubble yet, for example, someone does not come to school, does not give a notice, and 2 days after they say it was a COVID case, and you have a second case in that bubble, then you need to count the last exposure as the beginning of self-isolation. I know it's not tricky, and it's kind of tricky, and because of that, if you are unsure, ask for our advice. Call the local authority. Each one of us, Martin, Femi, Bernie, or me, will be able to advise on the best course of action for this. Just the last line on this is that if a new asymptomatic case is detected when the bubble is already self-isolation, so in some conditions, for example, you might not need to extend self-isolation of the bubble as well. But in some cases, if this case was in school in the day before, for example, you might need to extend self-isolation. So it's tricky. In doubt, call us. What is clear here is that if the bubble is already self-isolated, don't change the self-isolation time. If the child was in school and developed symptoms, extend the self-isolation times. Any other situation is a gray area that will need individual advice. And the last one that is connected to this question is if someone who was self-isolating at home, for example, because of a family case. So a children has just returned to school after 10 days of self-isolation because of a sibling or parent who was a COVID case. And then this child takes their home regular lateral flow test at home and tests positive. Does this child need to self-isolate again? So if this child just left the self-isolation period, we are being kind of flexible on that approach, because if the 10th day of self-isolation ends at midnight and at 7 a.m. in the morning that child tested positive, it's very likely that it's the same situation, that this child has an asymptomatic infection or an infection that will still develop symptoms, and this child will need to be sent home again for 10 more days of self-isolation. But the household contacts and siblings do not need to self-isolate in this case. So that's what is in red here. So the household contacts do not need to extend self-isolation if it's a few hours or just after or within the 10 days of common self-isolation for the household. But if it's a few days after, possibly everybody will need to be counted as a new situation, self-isolating again. So it's a tricky situation. Again, if unsure, ask for public health advice. The good advice here is do not test someone who tested positive within the last 90 days, because you will have extended periods of self-isolation unnecessarily. So if it was the child who tested positive, take out this child of the regular lateral flow testing program, because otherwise, if they test positive, they will need to start a new cycle of isolation, and the household will need to self-isolate again with the child. So the advice is do not test if it's not indicated to test. Then this is a simple figure from public health that shows, for example, I'll use the pointer. Okay, I'm without the pointer. So if Mike, for example, the first one tests positive, they will self-isolate for 10 days. The second one, Giorgio, is a contact, no symptoms, will self-isolate for the same 10 days. If someone in the 7th day develops symptoms, then this one will need to restart a 10-day period of self-isolation. But the period of self-isolation of the other does not change. And if someone in the middle develops symptoms and tests negative, it will need to continue self-isolating with the rest of the household until the 10 days are completed. The last one, I will not go in details through all of this, but I want to show you how complicated it is to produce a simple guidance now that we have several different types of tests available. So what I call route 1 here is for those who do not have an indication, who should not have a lateral flow test. So early year pupils, anyone who is currently self-isolating, anyone who had a COVID test in the last 90 days should not take an asymptomatic lateral flow test. But if this person unknowingly take the test, they will need to follow the advice on route 2, that is for those who are engaged in the lateral flow test program. So if positive, they will need to self-isolate again. And if the test was in an assisted center, they will not need a PCR. So all that applies to those who have the indication to make the test applies to those who unknowingly take the test. So that's the advice for not testing if you're not entitled to or not in the target group. The second route is for all those that are now encouraged to take a twice weekly self-test at home. So secondary early years pupils, staff, secondary pupils, household members. And it's very important, provided that those in that group are not self-isolating or with COVID symptoms or did not have COVID in the last 90 days. The first thing that I put here, besides engaging in the lateral flow testing at home, they need to keep all other prevention measures, because something that we have highlighted a lot is that people are feeling confident that they are protected against COVID after a negative lateral flow test. So I have no COVID, I can go and hug all my friends. So we need to reinforce to all of them that are engaged in the program that a negative home lateral flow test only means that that person was possibly not infected at that date. They can still be infected because this test is not as accurate as the PCR, and they should continue doing all that they would do without the program. If this person was previously advised to self-isolate, as I just said, they should continue self-isolating regardless the negative lateral flow test result. If the home test is positive, this person should book a PCR, but self-isolation should start, contact tracing in school should start. And if the PCR is negative, is route 3 here behind, then the case and contacts can leave isolation and return to school, provided that they are feeling better, that they haven't had a fever for 48 hours and have no other symptoms. So then we link this route 2 to route 3. That is the common route. If someone has COVID symptoms, go for a PCR test. Self-isolate while you wait for the result. If the test is negative, leave isolation. If the test is positive, make 10 days of self-isolation and make sure that school is warned of this result, so they can do contact tracing, self-isolation of the contacts. Route 4 is a small fraction, but that generates a lot of doubt. That is for those who take a lateral flow test in an assisted center. So if someone just decides that wants to go to a community test center and this person tests positive, so this person does not need to book a confirmatory PCR. They will need to self-isolate as for a positive PCR. If this person, be it a staff member, a child, or a parent, if they test negative with this lateral flow test, they should just follow normal life. If they are engaged in a home lateral flow testing program, they should continue self-testing twice weekly, and they should keep all other prevention measures, hands, face, space, ventilation, and all that you are well aware of. So I will make this available for you after the seminar, and I hope this is the last one that I don't need to produce a more complicated one as the roadmap evolves. That's what I had for today.
That's fantastic. Thank you, George. I don't think we've got any sort of questions in the chat. I'll give people just a couple of minutes if they do want to sort of type anything, but I think both you and Duncan have done a fantastic sort of job in walking us all through that. If there aren't any sort of questions, we will go on to hear from Ruth and Joe, who are also doing a double act. So I'll just give, as I say, just a minute to see whether there are any questions to our public health team. No, I don't see anybody sort of typing even. So again, thank you so much, George. Thank you so much again, Duncan. Ruth and Joe, can I hand over to you?
Yeah, I think Katie's got some slides for me somewhere. Marvellous. Okay, afternoon, everybody. So this is just, I suppose, the theme of this today has been, this is the end of, hopefully, the end of the sort of like the main pinch point of COVID, and we're starting to move towards the recovery phase. And so I just wanted to flag 3 projects that we're doing over the next term so that you can have those in the back of your mind as you're sort of working through into the next term. So Katie, the first one is about All Aboard. So I think some of you will already know about All Aboard because we've been running All Aboard for a number of years now. And it's an early years intervention to really support young children who are struggling with their learning or with their communication, but aren't necessarily children with special educational needs. So we're talking about children who, due to developmental issues or lack of experience, are at a disadvantage before they start formal schooling. And so what we looked at was whether we could adapt All Aboard as an intervention to support catch-up for children in the early years, because obviously when you're working with very young children, the one-to-one tutoring isn't going to be the best way of helping them do catch-up. So we looked at All Aboard, and I think there is a really good evidence base that that will be a positive way forward. So if you just go on to the next slide, Katie. So this is a really old slide, and you'll be able to tell that because it's got sort of like some really old descriptions of what it used to say in the early years foundation stage. But basically what it showed was when we did the first evidence-based iteration of All Aboard, there was a significant difference for children in all areas of their development compared to the control group. So we ran a control group and a group of children who took part in the All Aboard intervention. And across all areas, there was a significant improvement for children who did All Aboard. So Katie, next slide, please. And so what we saw happening was that by doing All Aboard, there was an increase in confidence, and particularly social confidence for children. So thinking about the children that haven't had opportunities to play with other children, children that haven't had the opportunity to socialise, I think there's a real connect there between what we found was a positive benefit of All Aboard and what you might be seeing when you've got children coming in who've had that limited experience because of COVID. What we saw was that there was increased willingness to work in small groups and to be able to speak to groups of people rather than just speaking to one adult. And so that's, again, these are things that I think we're going to see as we go forward. And just increased confidence really at tackling new skills for the All Aboard children. So it really works on trying to look at how do children learn in the early years? What is it that we know about how children learn, and how can we emphasize this and amplify this to support children's learning. The other outcomes are around friendships. The older board children had enhanced social skills that helped them to interact with other children. And then I've got to see what the bottom of my last slide says, because Jorge is, oh, there we go, greater focus and concentration. And feedback from parents as well. I think if you've got anxious parents, All Aboard was really good at supporting parents to help them feel that their children were being nurtured and cared for going into that educational setting. So I guess I'm thinking about in September, when children are going to be going into school, not having had a huge social experience, All Aboard might be an intervention that you want to be thinking about. And so the flag up bit is that we started our first round of training for All Aboard in February, but the second cohort of training starts after Easter. So if it's something that you're interested in, the time would be to train your staff up after Easter so that you're ready to hit the ground running with All Aboard starting from September. So Katie, next slide, please. So just to sort of like, and this is just the summary of it. So basically it's a 4-part course, and during the 4-part course, you look at and explore the nature of unachievement in the early years, and particularly how that might have been exacerbated by COVID. You're introduced to the All Aboard structure, and you're supported to create a tailor-made intervention program based around the core principles of All Aboard. You'll then go ahead and deliver that in your setting, and Katie and the team at CAER are supporting the evaluation of that. So we'll then be able to feed that back to you in terms of what difference has it actually made. Okay, Katie. So yeah, second cohort starts in early April. At the minute, there is a cost for this. I'm still touting for anybody who can provide funding, so there isn't a cost for it. There is a cost for it at the minute, but it's only £300 for 2 practitioners to come for all together for the 4 sessions. So it's, that's not very much really. Yeah, and Katie's team are going to evaluate that. So that's the first flag up All Aboard. So if you're looking at recovery, COVID recovery in the early years, think about All Aboard. Next slide, Katie, please. Just to remind you, and you can just skip straight to the next one, Katie. About the education emotional wellbeing practitioner team. So these are the practitioners who are picking up children and young people who've got social, emotional, mental health concerns relating to the experiences they've had during COVID, whether that's that they developed anxiety symptoms, they've got other behavioural symptoms. So you're able to make a referral into this team, and they will well, they'll triage that referral and and decide whether or not it's an appropriate referral to pick up. And then if they do pick that referral up, they'll work with the young person and with they'll talk to parents, and they'll talk to you guys as well about how best to support that young person. If they don't pick the referral up, they will be able to signpost you to where else to go. If you go onto Bradford Schools online, onto educational psychology, there's a whole tab for educational emotional wellbeing, and so you can access the referral form on there. And I think Katie will probably send the slides around later, so we can access it via the slides as well. And next slide, please, Katie. Oh, that's just tells you what I've just said. Next slide. And just the final heads up is about the supporting staff wellbeing program. So this is the program where we work with school staff, school management teams to look at wellbeing across your whole school. And then it also provides opportunities for individual staff members to take part in some brief PERMA interventions. And so that is kicking off once a month. You can join, there's a cohort sets off once a month, and it's all on Skills for Bradford. If you're interested, the information's on Skills for Bradford, sign up. And if you come along to the introductory session, from then on in, it's a sort of self-delivery, and there's, you can just carry on and do that yourselves. Bookable via Skills for Bradford, and there's no cost for that one. That is, I think that's it. Yeah, so my details are on there. If you want to have any queries, or if you want to ask anything about any of those interventions or offers. I'm going to hand over to Joe in a sec. So Joe Wilson, which some of you know already, is just last time we were on this webinar, there was a a big discussion around trying to focus on that wider, more broader agenda with children coming back into school. So rather than just focusing on catch up and just focusing on making sure we get back to learning and back to teaching, there was a lot of discussion around well-being, making sure we're giving children that broader, wider experience. And it just sort of coincided with a letter that a group of educational psychologists and other psychologists sent into the DFE, which just sort of chimed with that. So I thought it'd be useful just to have Joe to give a really brief overview of that, just to help to give backup really, and sort of like underpinning support to the approach that I know that school heads are wanting to take anyway. So I'll hand over to you, Joe.
Hi, folks. I'm aware that we're behind time, so I'll try and be quick. Sorry. So yeah, there's a letter that was sent to the DFE, and I think has also since been published in The Guardian. I'm not sure if anybody saw it or even may have been involved in signing it. It's come out of a few groups, some of which I'm part of and some of which are kind of linked together, which have been online over pretty much most of the duration of the kind of lockdown periods. And essentially trying to think about how we can build back better. And one of the things that the letter and these kind of groups are trying to particularly challenge is the kind of catch-up narrative. Now, a lot of that comes from speaking to young people. So, for example, Young Minds have been involved, and also a few youth organisations, I think, including one in Bradford. And a lot of the issues raised have been about this idea that what we have to do now is just sprint as fast as we can when we come into our schools. Everything is going to have to go at 100 miles an hour. It's going to be pace, 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 and we're not going to have time to catch a breath. And obviously, for a lot of young people, that was a concern that is a very, very significant one. And I have to say that I don't think it was necessarily helped by some of the messages that have been coming out of government and out of the DFE in terms of this idea of what catch-up means. So what we're trying to do was challenge essentially the notion of catch-up, and that comes from a few different places. First of all, we've already heard from several people about the fact that what COVID has done is increased inequality. And obviously that is a big issue, but what it also tells us is that it's not a new issue that has completely changed everything. Inequality was present. What we know is that it's been made worse because of the effects of COVID. And what that means is that the things that we were trying to do before to combat inequality are still likely to be important. They're still likely to be effective. We just now have even more impetus to try and put those things in place. We also know that there has been a massive increase in trauma and loss for young people over lockdowns. And we know very well from a lot of research what things like trauma and loss can mean. Unfortunately, lockdowns have placed an incredibly high burden both on young people and on the families around them. And that does then mean that there is likely to be some of those senses of trauma, some of those senses of difficulty. And those things have an implication, not just for learning, but for the wider development of young people. So what we were trying to focus on is, I suppose, a few key messages. The first one is that when we talk about learning, it doesn't just happen in isolation. I'm very aware that I'm preaching to the converted when I say that, but the best kinds of learning comes from curiosity. And you can only really experience curiosity if you feel safe to explore your surroundings. So one of the things that we've been really trying to emphasize is that actually well-being and being able to settle to learn is going to be much more important than just doing tons and tons and tons of teaching and trying to set off 100 miles an hour straight away. What we've also been trying to stress is that actually, while we talk about this idea of catch-up, really what worked before still works. High quality teaching is still high quality teaching. And we know from experiences where people have missed education for various reasons that catch-up doesn't need to be everything happening incredibly fast and everything being thrown at somebody. It needs to be high quality teaching and high quality access to education, which continues in the best way that it can do. That we don't need to be massively upping the pace for everything in order for stuff to be effective. What we're trying to do is make sure that the teaching we're doing is the best kind of teaching and is the right kind of teaching for our young people. And the other one is that the catch-up narrative, one of the things that a lot of young people came back to is this idea that it tells us that we've missed something, and it also tells us that now we have to sprint, now we're behind, and now we have to go as fast as we possibly can to try and catch up. And actually, the really important message that we get is that keeping pace is fine. We know that there are things that people have missed out on in terms of experiences, but also We know that a lot of young people might have been spending time at home doing things which have allowed them to explore their own interests or their own curiosity. We know that there's been a massive difference between those families that might be able to provide higher levels of education, that might be able to provide things like the technology and the opportunities, and those that haven't. But we also know that there is unlikely to be any value at all in just throwing all of those who have, who do seem to be further behind in terms of their learning, and just throwing all the learning at them very, very quickly. What we need to try and do is follow the same pathway that we had before, which was delivering good teaching, and we need to do it in a measured way that allows the right sort of pace. So I've tried to quickly break down into a couple of needs. If anybody wants to read the letter, my email address was on the invites and this for stuff, so you're very welcome to read it. I won't send it to everybody because I don't want to preach. But the first one is that what we need to be doing is doing really good high quality teaching. And I know that that's not a surprise for anybody, but I feel like it is something that needs to be restated. Everything doesn't have to be ripped up as a result of this virus. We just have to try and make sure that what we're doing is the stuff that we know already works. There have to be opportunities for play, for socialization, for development. We learn so much as young people, or young people in particular learn so much from what others around them do, the conversations they have with young people. And I know that I'm preaching to the converted when I say that, but all of the evidence, all of the science around this says that there is no point in just making everybody sit down and learn and learn and learn. And regardless of what might be said in Parliament about that, we need to make sure that there is also the opportunity for play, for socialization, for exploring. One of the big kind of mantras that I suppose I always try to live by when I'm working with schools is the idea of connection before correction. The idea that if you're going to confront someone with something that they can't do, you need to make sure you're doing it from a place of safety. And actually, it's a fairly simple idea, I think, the idea that when you're going to raise the challenge on somebody, you also need to make sure you raise the support to meet that. Now, again, I know that this is about very good teaching, and I know that we're talking about things that schools already know, but that connection is going to make such a big difference for somebody coming back in. And there is very little point in making somebody sit down to try and learn if they're not able to do it. What we need to do is make sure they feel settled to learn, that they are able to learn first. And finally, we know that clarity and consistency are going to be really, really important. There are families which haven't, for whatever reason, been able to provide that kind of consistency through lockdown. There has been all kinds of stories that you hear about breakdowns and about some of the traumas that have happened. And so making sure that school is the place that you come back to, and it's going to be there, and it's going to be safe, and it's going to be the same tomorrow as it is today, and the same the day after that, is really, really important. What we don't want to do is make people think that school is this big, scary place where you have to learn everything very, very fast because you've missed out. Actually, school should be what it was before, a place of learning, a place of safety, and a place of connectedness. And that's all the messages that I have. But if anybody's interested in reading the letter or in some of the other things that some of those working groups I'm talking about have been involved with, please feel free to drop me an email.
Thanks so much, Joe. Actually, I think we'll just circulate it around the groups. If you can share it with Katie, Katie will make sure the whole sort of a group gets it. I must say, I feel like I've just had a counselling sort of a session you calmly write down. So thank you for that, Joe. It's really useful. Yeah, so massive thank you to Ruth and sort of Joe for that sort of a session. Christian, over to you to hear about Swoosh, which I think segues nicely from what we just heard.
Yes, okay, and it's just a couple of minutes from me before we hear from our head teachers. Okay. So to let everybody know once again about the School Staff Welfare Support Service, we've got some repeat people on the call tonight, but it's some new colleagues here as well. This is the access to counselling and other therapeutic support. Really important that you realise this is for all staff now. It was launched as being for school leaders only. It's now for all teachers and all school staff. Anybody who is in need of a health check, a well-being check that will lead to some therapeutic support or may not need to lead to it, the phone lines are there and they're available to access now. And you can see the numbers on the screen there. They are in that flyer which has been circulated before, but just make good use of it, please. You've been given in some information about the Seller Trust training programs, low mood, Stress Buster and Sleep Hygiene, also one for leaders around suicide awareness. And those courses have been available this term, and they'll be available again next term. Ruth's already talked about Bradford's educational psychology support team and their whole school support that they're available to deliver. And I've mentioned last time about the peer-to-peer communication elements, the webinar space outside of the webinars, which is a peer-to-peer place to contact. It's a message board, and that's being created at the moment. It should be in a place that we can release that to you next time, information on that. Okay, now, okay, so really powerful and important news to tell you today. The School Staff Welfare Support Scheme and this webinar program, we've received good news in terms of the funding for this, carrying up this conversation on into next year. And I've mentioned this before, but we are pivoting away from COVID response into COVID recovery, picking up themes in this conversation that we've had today and into next year around whole child support and work across the system in the space of COVID recovery. So we want to be picking up themes around social and emotional mental health, physical health, and indeed around classroom inequalities into next year. And that starts with the next webinar. Really important that we get good attendance next time that you come along. Kirsten England also speaking at that event. That forum I've talked to you about is being built now. It should be in a position to be able to be used next term, not only through conversations within this group that are here today, but also in your own subgroups. So it's there for you to be able to be used. Also, Duncan spoke around this earlier on, but next year we'll see the very important launch of the Bradford Living Well Schools offer, a one-stop shop, one-stop place to access all the support that's going to be out there from CAER, from the school-led system, from council, and from the health services and the CCG around social and emotional mental health, physical health, support for schools. So I'm letting you know really today that we are pivoting away from that response stage into that recovery stage. Next term, focusing very largely on children's physical health, while still continuing with the COVID messages, still the same type of input from our clinical experts and the same kind of input from public health through the Bradford Council. I'll come back to the main forum now.
Thank you so much, Christian, as always, for your presentation, but for the great work that you're doing. And I think you eloquently expressed the plans and determination of everybody to work together. Thank you so much to all our speakers thus far. We now get to our eagerly anticipated talking head section. And John's going to kick us off with a quick reflection on the road back to school normality. So John, without further ado, can I hand to you?
Certainly. Hello, everyone. Hope you're all good. It's nearly Easter. In fact, I kind of break up tonight. Tomorrow's an inset day, so I'm quite excited. Anyway, I'm going to start us off tonight by talking about something which we hope is going to be wonderful, something that I am calling the road to normal. Everyone I speak to, staff, governors, parents, children as well, we keep referring to the road to normal. We know COVID is still here and we need to be careful and maintain bubbles, etc. But, slow, steady and sustainable and all that. But we are planning for normal, hopefully by the end of June, if everything goes to plan. For too long, school has not felt like school. If nothing else, this last year has proven that we will never be able to replace a teacher or a classroom with a computer. We are very pleased indeed to be back in those classes. And although some of the kids actually found it a bit difficult, I think particularly the ones who've been in their little secure bubbles of 15, and all of a sudden they were invaded by these aliens who've been at home. And I think that some of the kids found that a bit quite difficult, but we're confident that, school's somewhere that kids feel safe and happy, and hopefully it'll become normal again. We are talking about the road to normal. We've already started to reintroduce some of the things that are normal, some of the systems and processes that ensure high standards and quality education. I'm talking about boring but necessary things like, writing moderation, book scrutinies, lesson observations, end of year assessments, because we do need more than ever to have amazing teaching. I've had pupil progress meetings this week focusing on catch up. And you know what, actually pupil progress meetings felt nice because they were normal. Yeah, I've never felt as pleased to be in a pupil progress meeting in some ways. It's felt like a long time. But that's not the stuff that gets us excited, is it? When we're talking about the road to normal, talking about the reasons I loved school as a child and why I loved it so much, I'm still in a school. We're talking about kids needing to sing, dance, play, explore. We have planned residentials, which I don't know if they're going to be able to take place or not, but we've planned them. I've got 5 residentials planned for July. I don't think my wife's going to see me much in July, but I'm sure she'll be fine with that. The house will be much tidier. We're planning to go to London, Whitby, Alton Towers, the Yorkshire Dales. We pray to God that these will be able to go ahead. If not, they are cancelable and we can replace them with day trips, but that's what we normally do. So we want to get back to that if we can. We've had science weeks in schools. Fundraising during Lent took place as normally as possible. We have had Holy Week liturgies, because we've kind of like been doing Easter week this week in our schools, trying to run them as close to normal as possible. We haven't been able to all get in the assembly hall, but we did do one liturgy outside, a Palm Sunday type thing, and it felt almost normal, which was great. So there will, of course, be bumps along the way. We've already had some. Last week, we had to close 4 bubbles at St. Anne's, and the infection rates in Keighley are astonishingly high. The highest in the area and probably some of the highest in the country. And we've got to really, really take care, but we've got to plan for normal, for everybody's sanity, not least, obviously, the children need to have this. The sad thing for a lot of our kids, normal is lockdown. And so we need to get back to the old normal. And there are going to be big bumps ahead on this road to normal. But this road to normal needs to be travelled, no matter what the bumps or the diversions, because the destination will be worth it, we hope. And I think I'll finish there.
Great, thanks so much, John. If Duncan's still on the line, there's a question actually for Duncan that I should have picked up earlier, which is, Duncan, it's just from Philippa, which is around the number of inquiries from parents about the 500 payment following bubble closure for those eligible. And the feedback is the council web form doesn't seem to be set up to facilitate this kind of claim. Some parents are requesting a code that begins with Z. Where can these codes be obtained from? Please, can you advise? You're on mute, Duncan.
What was the thing about beginning with Z?
Some parents are saying that they need a code that apparently begins with Z.
Oh, right. Okay, I haven't set this scheme up. I'll make an inquiry about that. So is it someone can just put in the chat? Was it a specific council form or whether it's a national form?
We just got something coming in from Martin, actually, which is to Philippa, which says, have been working with the council's benefit department on this. They're developing the information on their current webpage in terms of the changing eligibility. More info in Mariam's email tomorrow, I hope. The parents' carers will need the contacts letter from school with name of child and dates of isolation. No need for any code as far as I'm aware. We're on it. So that does look like that's happening, but maybe Duncan, I don't know if one of you or the sort of team can reach out and make sure that something does come out from Mariam. It does seem like there's a degree of clarity required. Yeah,
Martin's working on that, and the other thing is it's going to be backdated. Although the information's coming out in early April, it's backdated into March as well. But we'll get something out on that. Martin's working with the other council team on that.
Brilliant. Thanks so much, Martin. Thanks so much, Duncan. And again, apologies, Philippa, I didn't pick that up earlier. We are starting to run behind. I think we feel it's best that we'll not do the breakout groups. I mean, everybody's very very tired, but it'd be great to hear from all the other heads. So I think what we'll do now is hear from the heads, see if there's any other sort of questions, and then we'll call it a day. So if I can now hand over to the other John, who's going to talk to us about COVID recovery, health, well-being, and exercise. So over to you, John.
Thank you. I'm trying to be as optimistic as John Devlin, who's got his training day to look forward to tomorrow. I have a day followed by 4 days of Easter school. So I know that makes you excited, John, but unfortunately the GCSE assessment period stands for no person. It doesn't stop for anyone. Easter's not going to stop that. Just in relation to our health and well-being, it's really hard for us at the moment with everything going on around the GCSE stuff and that priority, but we've really tried to establish a couple of key things about our return to school. And I think these probably can link to secondary or primary, but it's what we've done here, and it's something we felt was important. So we had 4 key priorities: re-establish relationships, be kind to each other, rebuild student confidence, and routines and expectations. And it was in that order. The kindness, relationships probably joint first, but it was that order, and that was the priority. And although we returned to school and we got the GCSE assessment situation, we purposely prioritized returning and that relationship, that kindness as a starting point, because we know that many of our families have gone through challenging periods. We know, I mean, it was, I wasn't surprised to hear that Keighley has got a high rate at this period. I know up to Christmas, we'd lost 20 plus grandparents or parents from our school community to COVID. So it's been a particularly intense time for us. So what we've prioritised is, during lockdown, we did prioritise our PE department ran daily challenges, and they were based on activities people could run in the home, and that's continued as we come back to school. We make sure PE lessons are very active and engaging from the start, so less teacher talk, more activity, get them moving as soon as possible. As a PE specialist, it's something that I take a particular focus on. Our extracurricular clubs are ready to go up and running. We've got summer clubs coming, activities. I've engaged with a couple of companies that I know some of the resources and the owners of the companies about running activities outside of my staffing team, because I'm worried about our staff period. We only actually have a 5-week summer holiday because we've moved to a new timetable, and we have 2 weeks of October. So I'm very conscious about that. But one of the things we have done moving forward is we've increased PE time for 2021-22, which probably is different to a lot of schools, but we felt it was important. And we've increased the profile of PE and increased it as an optional vocational course that our young people could take early. And it was something that we felt we had to change, because PE's not always been a big focus at the academy, and it was something that's obviously something that I'm passionate about. But I think happy. I go back to Maslow's hierarchy of needs. Happy, safe young people perform well, and actually that's going to have a big impact on their results and their performance. In terms of the health and wellbeing side, we're very lucky. We're part of the project trialing out mental health practitioners in school. So we've got mental health in school for school support in school for everyone. So we've had training for staff. We've had check-ins with key students. Heads of year have been reporting in and checking in appropriately. So the transition from home into school, that's been in place every day. We now have in-school drop-ins every day where students can allocate mental health support and say if they're not feeling all right. Our assembly program explained what feeling not all right was about, what's okay to say, and sometimes encouraging that and realizing that, telling people how you feel when you're struggling, you're finding this hard is really clear. And I'm quite precise in the language we use, because I tell the kids it's been tough, it's been a long period. And I think the week before students returned was probably the lightest week of the term, which was about a 70-hour week, and that was the reality. And it was making them realize how much work we'd done to get them back. All of our tutor time, which is 25 minutes a day, has been focused on well-being, self-esteem, and healthy choices. And so we have a reading program normally goes in that period, and we felt this was more beneficial to our students at this time to re-engage them with learning. And some of that will transfer over the Easter break. Pastoral check-ins for any students that are struggling, phoning into the families. We've had a couple of students on reintegration programs who have really struggled coming back to school, but that's increasing now, and we're getting them back to some sort of sense of normality. And we have a nurture provision. We use the incredible 5-point scale intervention to help equip students who struggle with emotional regulation. And we've also, run forest school and a gardening intervention with some students to encourage them outside and to get them more active. And they're specifically targeted by their year leads because of their needs. And sometimes they're very isolated inside, computer game based. After Easter, we've got a big mental health intervention program for students. we've got a mental health program for staff. We've engaged with external providers, and we're just engaging with a company now about running a program throughout the whole summer term. We have self-esteem, healthy relationships, and emotional group work for students, and we're just engaging with support with for some of our CLA students with changing lives with one of the equestrian centres. So we've been very, very creative about what we're doing. I know not everyone has the resources that we might have in secondary in terms of pastoral, but because of the community we serve, obviously we've really prioritised this to make sure that we're on top of this. I mean, I speak about investment in the time now and what's going to be a 6, 8, 12-week plan for us to the summer, because this is going to help us in from September onwards. And it's something that we've really prioritised, and we've put massive recovery plans in place for the next 4 years around catching up learning. But that can't be that can't affect their health and well-being. And so often in secondary, and especially at Key Stage 4, they start to come out of PE to do extra intervention. We've put a ban on that from now on, that they can never come out of PE and our health and well-being lessons, so that they become the new priority. So there's some of the changes we've put in place. Again, they're just what we do here at UAK. That's based on our context, and we feel that we're already starting to see real positive. We've had a fantastic return to school. It has been hard work, but I expect that to continue. But the team are very much up for the challenge and looking after the holistic side for our young people. Thank you.
That's brilliant, John. Thanks so much for that. So many really good, useful insights. And it just aligns really, really well with what sort of public health sort of a team are trying to sort of pull together around sort of living well. So again, just a real opportunity here for, I think, to get all of this in alignment. So thank you so much, John. So we're now going to hear from Beth, who's going to be talking to us about the value of relationships and attachment for all children, including those with special needs. So over to you, Beth.
Hi, I think what I'm going to say fits in a lot with what other people have been saying, actually. I think the message has come through again and again through pretty much everybody who's spoken tonight about the importance of building those relationships back up with students. I think we've found that that's something that is always really key to us at Hazelbeck. Obviously, for our students, some of them are non-verbal, and the communication can be really difficult for them. They can struggle with emotional and with emotional regulation. For us, being able to spend that time, we were really clear that for the first certainly week that they came back, the only thing that mattered was actually having fun and enjoying being in each other's company again, because that was the most important thing, to make sure that our students felt okay. Then often not able to say what's happened to them during that time. So staff were really sitting back, taking that time to observe, joining in with students rather than taking the demands off young people, to make sure that they actually had the time to be able to reintegrate, to be back in the school environment, taking some of those pressures off the number of transitions and how that was working was really important to us. So a real slowing down and just focusing on rebuilding those relationships, making sure that those attachments were back there, making sure that environment for learning to be able to happen is in place beforehand. And I don't think that that's unique to young people in special schools. I think that's actually the same for any young person who's going into a school environment, or into any environment really. Obviously, alongside that, there's kind of the establishing of routines and of boundaries for young people, but that's all part of that relationship building. But they need to have that trust there to know that's okay, and when those boundaries aren't met, or a young person goes into crisis, there's the real focus on continuing to make sure that those relationships are rebuilt, that time is really spent on doing that as well. So for us, that has been a huge focus, and continues to be a focus, and will continue to be a focus for forever, really, I think. There's no way away from that, and I think that has to underpin. It certainly underpins everything we do, and I think it is something that's really key going forwards if you're wanting to look at young people's mental health. You know, often young people with SEND who have additional needs can already have quite low self-esteem and low confidence. So building up those relationships and making sure that they feel understood and valued, that they can feel those successes in the relationships that they're building up. That's the first step to success, is what we kind of believe in, and that seems to work for us. So, you know, having those opportunities to spend time in different environments, being outside, enjoying that play. You know, I've heard people talking about the need for that play, and that's something that, you know, we might be a secondary school, but how we adapt that and make sure that that's still appropriate and that those opportunities are still given for that is really important before we start bringing in all of those demands of, you know, learning and moving, you know, working towards those goals. They're still happening, but it's making sure that they're done in a timely manner really for us that's been really important. So and that seems to have resulted in a successful transition back. Some young people who we thought that we may have some quite significant behavioural challenges with, that's been far less than we thought, and whether it's completely down to that, or whether some of it's just luck of the draw, who knows. But I'd like to think that some of it is down to the fact that we have just spent that time going, okay, this is important, and we need to make sure that actually young people are comfortable and are secure in school before we start putting those demands back on them. So yeah, and that's it from me. Thank you.
That's fantastic, Beth. Thank you so much. It's really interesting, isn't it, how we're hearing the same messages come from so many sort of different sort of speakers. And I've got to say, this is music to my ears. Over the last sort of 20 years, we've run a number of very, very large sort of studies, which are very consistent with a number of studies around the world, which show that actually activity is really good for attainment. They're not sort of separate things. And also activity is really good for children's social emotional well-being. So we need to take that holistic sort of approach, and somewhere along the line these things got sort of divorced, and school became about sort of something else. So what a great opportunity we have, I think, to start redressing sort of our balance. And I think if we can capture all these sort of voices, hopefully we can sort of shift national sort of policies around this as well. So thank you so much for that sort of Beth. What we're now going to do is hear from Rob, who's going to be talking about renewing school relationships with the communities.
Okay, thank you very much. Yes, so I don't know if many of you, I'm sure many of you actually, have heard and seen Rita Pearson, and she talks about the power and connection of human relationships, and that seems to be kind of a theme that's woven through everybody's talk this evening. And I think, you know, that's probably the thing that's taken the biggest hit for all of us wherever we're working. And I think, you know, all primary schools, or all schools, are a microcosm, aren't they, of society, and they're all quite unique in their own ways. But I think at Saltaire Primary, we've definitely, you know, our community coming together is a real strength of our school. We have so many events during normal circumstances where our parents come together and take part in events, and whether that's from a social perspective or supporting children's learning or whatever it might be. And that has taken a huge hit over the course of this last year, and I think we're very much looking forward to being able to welcome parents back in a really meaningful way as we move into the new academic year. But I think, you know, as I've said before in these webinars, I think one of the biggest things or challenges we've faced in more recent months is the fact that we have had a large proportion of children in school, and I think that's led to certain issues around perception in terms of how parents who have not been able to send their children to school have perceived the reasons behind other children being here in the building. And I think that has led, thankfully, not to direct confrontation with us as school leaders, but to confrontation between parents themselves, be that on social media or on WhatsApp or what have you. And I think it has kind of stirred up very strong feelings amongst the community about who should or should not have had a place here at school. And, you know, I have heard it said that some parents have said, I think there's going to be some very cold relationships on the school playground after this. So I very much am aware that that is something that we need to kind of make a priority as we return to a more normal way of working, that we kind of ensure that parents have the opportunity to come together, to socialise, to take part in a kind of shared agenda, if you like, really, in terms of what matters to our community. So I think the priorities for us as we move into the summer term and we start to plan for the new year is how can we bring parents back on site in a COVID secure way, and obviously that's unclear at the moment what that's going to look like. As all schools do, we have things such as our year 6 graduation events where, you know, that's kind of brings parents on site a lot. Normally last year, all of that was swept aside. We managed to do some of that virtually. So I'm very much hoping, and we're planning that, can we do that in a kind of in an outdoor sort of way? Can we have some sort of kind of ceremonies and performances that can still bring parents together? And then we think about the kind of nuts and bolts of things, really, kind of things like, obviously, as we've discussed, lots of people have been discussing this evening, well-being being the key, the priority kind of issue, and how we can support parents and families' well-being as they come back. Establishing normality. As many schools do, we have a parental involvement worker, and I think, you know, that role is going to be incredibly key as we move forward. They deliver a lot of the kind of parental workshops, things such as family links and our online safety work. So that role, I think, is going to require further expansion as we move into the next few months. One of the things that we've really noticed is that children's online safety experiences have become something of an issue. Nothing too worrying, but just an awareness, really, that they've had a lot more access to online, to social media and things like that. And I think, you know, I think it's going to be very important that across our community, we reach out and we kind of begin to kind of educate parents again, I think, in terms of the dangers that kind of activity promotes. And so really for us moving forward, it's about how we communicate with parents. That's been a kind of key mantra for me. I've been very proud of the way in which I've communicated to parents over the months, but a lot of that has been in written form. We have had things such as virtual assemblies and celebration assemblies where we've invited parents along each Friday to share in the achievements of their children. They'll continue until we get to the point at which we can actually bring parents back into the building. Our Twitter feed has been invaluable in being able to kind of share with parents some of the events happening inside the building to kind of bring them kind of more into the loop, really. And my kind of weekly blog has also been helpful. But like I say, the sooner we can kind of bring parents back into the building in a COVID secure way, the better. Hopefully by the end of the summer term, we'll be able to start having more of those assemblies, more of those kind of social events that bring people together. It feels very broad and quite woolly, I guess, at the moment. I think that's probably where we are at in the term. But I think for us as a school community, and as a head teacher of Saltaire Primary, I'm really aware there's a lot of work to do to bring people back together and to kind of rebuild those social relationships as well as everything else. I think that's everything I've got to say for today, so I'll hand over to the next person.
Thank you so much, Rob. That's really great to hear. So we'll move straight on now to Sarah, who's going to talk to us about making schools happy, positive places for children in the early year settings. So over to you.
Hi, everybody. Yeah, I actually have asked my deputy, who's sitting at the side of me, to do this because he's much more of an expert than me at EYFS, and he's now crawling under the table. So that's really professional. Anyway, hi, everybody. I think with EYFS, I think what we have done here is get it right, actually. And the main thing I'm going to start by saying is this is not about pushing for early learning goals in any way, shape or form. This is about really using the opportunity to use and reintegrate children back into the setting to enable them to have that long-term recovery curriculum. We're very keen on sustained shared thinking at Newby, so everything we do, it has a really clear sustained shared thinking impetus. Really, we use that whole, I can never think of the word, and if Gareth was sitting here like he should be doing, instead of sitting at the side of me giggling, then you would have those words for me. So we feel it's really not just about COVID at all. One of the key things, just building on from what Rob just said then, was that some of the key things that we've done is that our parents can no longer come in like they did because of COVID. So it's been really important that we maintain and keep those parental relationships. And those parental relationships are absolutely key. Got youths wandering through. Beautiful. It's all lovely at this time. So it's been important that my staff have been able to keep talking to parents outside, keeping that social distance, keeping the parents very well informed, sharing those learning journeys, sharing those milestones, sharing all those things that the children are doing. But having that sustained shared thinking focus of it being about recovery, allowing them and knowing that play is the fundamental and most important aspect of early years. It's about the greeting, it's about the lots of play, it's about being outside as often as possible, it's about the provocations that we use in the classroom and keeping them COVID safe, as well as making sure that children are happy and smiling, and the happiness comes from that play. So early years pedagogy needs to be based around play, not on outcome. Please, please, please move away from outcome, and the outcomes come through play and through development of that sustained shared thinking. The learning environment is important. We know that lots of the learning environment within the early years classroom has to be COVID friendly, but not to the detriment of children. Everything can be sprayed, and we have a spraying policy. We are not stripping back so that nothing can be used, because that doesn't help anybody. So children happy in the early years, quality interaction with parents, quality interaction with children through sustained thinking and provocations, and keeping the play at the centre, not the outcome, the process. Be process driven rather than outcome driven. All I have to say.
Wonderful, thank you, Sarah. Very beautifully and eloquently expressed. Thank you. So last but not least, we're going to hear from Lynette about supporting children with communication and interaction difficulties after lockdown.
Thank you. Evening, everybody, and congratulations. We are on the countdown to eating our body weight in chocolate, and I can't wait for that. Well done, everyone, getting this far. So yeah, just thinking about children, supporting children with communication and interaction difficulties. I mean, that is such a big field on so many different levels now. And one reflection that we have had is the children who, for some of them, it's as if before there wasn't a need, but actually just teaching them to interact and play and engage in that way has become something that we need to address aside of children that have got some level of diagnosed need in that way. We've found that children have returned to school unsettled this time. The children that were struggling before for very genuine reasons, that need seems to have been amplified, and their behaviours seem to be amplified as well. I have put that really down to the fact that when we came out of lockdown last time in September, in the build up to returning to school, children had had their summer break. They'd been able to get out and play and see their friends and interact and let off some steam, however they do. But this time we've gone from a national lockdown into a school situation when actually we're still under lockdown conditions as well. So it's been really quite difficult. A couple of things I'm going to mention are probably themes that I have, well, they are themes that have already been mentioned. It's right back to basics. It's quality first teaching. We need that, and we need consistently good teaching provision for our children. We need to be able to understand our pupils well, and we've had a lot of professional conversations around the contextual understanding people's needs, and working out whether actually how things are presenting, is that a need that has arisen out of COVID? Or is that a need that has been there and it's just starting to show itself now? So it's been very clear as to what is that level of need and where has it come from. We've had a great deal of parental conversations. I think parents have really reached out to us a lot over lockdown, and children with additional needs, parents of children with additional needs are being really honest, and they are worried about this idea of catching up. That I think the media are doing a wonderful job of really stirring up for us, so thanks for that. But they're concerned around that and what they can do to help. And probably, like what was mentioned before, they've been through this lockdown in the dark, wintry, snowy, awful months, and they haven't had a break either. And that's starting to really wear on some patience and skills there. And then, so that's really strengthening that partnership as well. We've looked at a range of strategies and things that we've done, and we're really working on an assess, plan, do, review model. And like everybody else has said, this is about moving slowly. This is a marathon, it's not a sprint. This recovery is going to take a lot of time, and we need to invest in that with depth. Otherwise, we're just going to scratch the surface. We looked at phased return for some of our pupils before the 8th to get them in, and for some of our pupils we extended that phased return until they were ready. For exactly what other people have said, if their children are not ready to learn and not able to interact and deal with that changing routine, then they're not going to learn anything, and we need to make them feel comfortable, secure, safe, all through Maslow's hierarchy. We've looked at social stories where appropriate, visual timetables. We've revisited how staff's use of language, how instructions are presented to children. We've looked at emotional registers again, how we involved our SENCO and our strategic lead from the Trust for SEN. We have put in place an electronic referral system so that teachers can flag at the first instance if there is anything they want to discuss with somebody who's seen as more of an expert. We use Mabel for our speech and language support, and they, if you subscribe to them, that they also have something that's called Mabel Academy that is quite new, and that's a range of online webinar style training, online training, where you can just learn more in-depth things, particularly around bringing children back to school after COVID, communication friendly style classrooms, all those kind of things. We've invested a great amount in the CPD of our teaching assistants. They're all doing at least a level 2 in understanding autism, which they're going to be able to use. A number of them have also done young person's mental health training to make sure that we're not confusing a language or interaction need with potentially an emerging mental health need. We've invested training in our pastoral team. But we're really at that point now that other people have touched on, in really looking at those curriculum opportunities, investing in PE. How are we using our curriculum to get the best outcomes for our children? And, you know, like I said at the beginning, and like Joe has said as well, let's just move slowly. Let's not panic about this. We need to take our time and put some real depth of thinking into what we're doing and how we're going to make a difference for the children. You know, it's great to see and great to hopefully feel that we're moving out of this and we're moving to brighter times, but it's not over. It's not over yet, and it's not going to be over for a little time, I'm afraid. So enjoy Easter and dig deep, everyone. Thank you.
That's great. Thanks, Lynette. So I see you progressed from wine through to sort of a chocolate over the sort of course as well.
I didn't want to mention wine again, Mark, in case I was getting a reputation.
Excellent. Thanks so much, Lynette. Thanks so much to all the heads, and thank you so much to all of the sort of speakers today. Just going to quickly hand over to Christian just to wrap us up. And then, as I said, everybody's sort of very tired. Let's be kind to us, sort of ourselves, and give ourselves a few minutes off. Over to you, Christian.
Yeah, I just wanted to say thank you, everyone. It's a real big thank to the school leaders and the other colleagues who are represented here this evening, and the other colleagues who've had to leave slightly earlier. And like I said before, this is now a time for us to grab a hold of this opportunity moving into the next term and into the rest of this, into the new academic year, moving Bradford from COVID response into COVID recovery. And that's going to require a really big team effort. So I'm asking you to particularly spread the word about the value of what we're doing here, to reach out to your colleagues, talk to them about the important work that we need to do as a city. And we will be talking as a group with the lead head teachers that are on the panel here about a new way of working as we grab a hold of that COVID recovery period. Lots to do, amazing ideas presented here this evening, and still needing to keep working and focusing on the demands of COVID, because that challenge has not left us and it's going to stay with us, recovering from the challenges there over the next couple of years. It's time to release you for your Easter break, but thank you so much. I'd be really grateful if the head teacher colleagues who've spoken tonight could just stay on just for a couple of minutes as well, but everybody else, have a good Easter break. You have deserved it.
Great, thank you so much, Christian, and yeah, thank you so much, everybody, and we'll see you at the recovery webinar. Thank you. Bye-bye.